Hi everyone, I'm Dr. Hu from China Medical University. Today, we will talk about deep vein thrombosis, a common disease in the real world. This part includes general information of definition, epidemiology, pathogenesis, and risk factors, and clinical manifestations. DVT is a condition where a blood clot formed inside the deep vein, usually occurs in the lower leg, can also develop in the upper extremity and other areas. The potential danger is that the clot can break free and travel to the lungs and sometimes cause fatal pulmonary embolism. Now, a term of venous thromboembolism, VTE, has been integrated DVT and PE and comprises these two interrelated conditions that are part of the same spectrum, DVT and PE. Epidemiology. VTE is the third most common life-threatening cardiovascular disease after myocardial infarction and stroke in the United States. The annual incidence of VTE is 1 or 2 per 1,000 persons, and the overall mortality rate is between 60,000 and 100,000 annually. 1/3 of patients with VTE present with PE, and 2/3 present with DVT. Compared with DVT, PE is more often fatal, has a higher recurrence rate, and it is associated with more serious long-term complications. Of patients with proximal DVT, 40% has an associated PE, whereas 70% of patients with PE also have DVT. This slide shows the magnitudes of VTE. There are 2 million cases of DVT per year in the United States, and about 600,000 cases develop PE and caused 6,000 deaths, with an estimated cost of VTE care about $1.5 billion per year in the United States. In China, we have the similar situation, that VTE hospitalization rate increased this year, and the good news is that the in-hospital mortality rate decreased this year, as we have been paying more attention on VTE in the recent years. Pathogenesis and risk factors. Vicious triad is the cornerstone for assessment of risk factors for DVT, a broad categories of factors that contributed to DVT, including stasis, endothelial injury, and hypercoagulations. Risk factors include immobilization, trauma, surgery, pregnancy, hormonal therapy, advanced age, obesity, malignancy, previous VTE, varicose vein, infection, and other inherited thrombophilia. The consequences of VTE, including PE, pulmonary embolism, sometimes can induce fatal PE and cause sudden death, and also have chronic pulmonary hypertension, incompetent valves, and recurrent VTE will induce vicious circle, and also have post-thrombotic syndrome with the pain, cramps, heaviness, and paresthesia, and the skin induration and ulcer, and hyperpigmentations. Clinical manifestation, just like a tip of iceberg, clinical signs and symptoms are highly variable and unspecific, but remains the cornerstone of diagnostic strategy. Many patients may present asymptomatic. Some reports show that about 80% of patients might be asymptomatic. Typical symptoms include pain in the calf, thigh, or inguinal region, and swelling depends on the thrombosis location. For example, in the iliofemoral system, the DVT will present severe swelling and superficial venous congestion with increased skin vein visibility. Classification includes central type, located at iliofemoral vein, and peripheral type, mainly located in the distal of the popliteal veins, and the mixed type, the diffuse type of the DVT in the lower leg. Spectrum of DVT includes calf vein thrombosis, femoral popliteal DVT, iliofemoral DVT, with a severe type of the phlegmatitia albidolens and phlegmatitia ceruleolens. In the most severe type, DVT can induce venous gangrene. This slide shows the severe type, mainly in the iliofemoral venous system. At first, phlegmatitia albidolens is characterized by the massive swelling confined to the major venous canal, but without ischemia, as collateral veins are still patent. PAD is known by the triad of edema, pain, blanching without cyanosis, also called milk leg. And phlegmatitia ceruleolens, PCD, characterized with massive swelling, cyanosis, and pain result from the extensive thrombosis of the iliofemoral vein outflow, which in turn may lead to the arterial ischemia and ultimately gangrene with a higher amputation and mortality rate, also called painful blue leg. Summary of this part: DVT is a common disease in the real world, can induce fetal pulmonary embolism with a very huge social and economic burdens. Visuous triad is a cornerstone of pathogenesis of VTE. The clinical manifestations are highly variable, need to pay attention to typical symptoms of pain, swelling, and superficial venous congestion. Thank you.